We're being urged to stay up to date with vaccinations as health authorities in New South Wales and South Australia warn of a potential measles exposure risk. This comes as the US is dropping the number of vaccines it recommends for every child, a move that has been slammed by America's paediatricians. Catherine Bennett is a Professor of Epidemiology at Deakin University and joins us now. Professor Bennett, thank you for your time. And can you just remind us at the top here where we're at with measles vaccinations in Australia when we get them?
So these happen in the first months of life. For children, it's really important that they get 2 doses of measles vaccine. It's a very effective, very safe vaccine, but it's really having the 2 doses that gives great protection. And in fact, as you mentioned, the outbreak in America in 2025, they saw over 2,000 cases reported, probably other more mild disease that didn't get reported. But of those, only 4% had both vaccination doses. So the 2 doses of measles vaccine are important. And thankfully, they're still in the schedule in America. They haven't removed the MMR, which includes measles. But at the same time, it's the messages that are going out more broadly about vaccinations, including these latest pullbacks on free vaccination in America, that actually have a negative effect across the board when it comes to parents' natural uncertainty or caution about vaccines if they're getting these mixed messages.
So how concerning is this exposure that we've had in Sydney and Adelaide, and the fact that this is the 3rd case in New South Wales in just a week?
So these are imported cases. We had reached elimination like America 20 years ago, 10 years ago, we were designated to have eliminated measles locally. So you would see imported cases. Occasionally you might see 1 or 2 local cases infected from those imported cases. The risk here, though, is as our vaccination rates have dropped, you need them to be up around 95% for measles because it's so infectious. But that's dropped away a little bit in young kids. So it means when you do have someone who unknowingly contracts the virus whilst overseas, these were from Southeast Asia, comes back into Australia, and in these cases have gone to public sites, that people who aren't vaccinated in those sites are at risk of contracting the infection. And we don't want to see, because of lower vaccination coverage now in Australia, there is a risk that we will start to see more local transmission as well. So that's why these calls are so important, that people should take note of those locations and really monitor closely for symptoms, just so if anyone has been exposed and actually does develop an infection, that they're onto it straight away. They can be looked after, but it also reduces risk to other people.
And what sort of coverage do we have? And, do people and even doctors know the symptoms that we should be looking out for?
Look, 20 years ago when I was studying in infectious diseases, it was one of the problems that our clinicians in this space weren't actually seeing a lot of measles. The vaccination programs that rolled out in the 70s were really effective in actually reducing the exposure in the community and the susceptibility to infection. So those early symptoms are actually quite vague, in a sense that you can get fever, you can feel unwell, there might be a bit of a cough, runny nose and so on. But there's also then a rash that develops a few days later. Now, unfortunately, this is already when the disease is set in, when the person's been infectious from 24 hours before those very first symptoms. But 3 to 4 days later, they might get a particular rash, which most physicians wouldn't have seen in their practicing lifetime. That's probably changing now. We've got more travel, more people bringing the virus in, but at the same time, it's really important that people do get checked out early. There can be nasty complications. I know people think, when I was a kid, everyone got measles, we didn't have the vaccination for the older Australians. But in reality, they had some partial immunity in the population. People were exposed to the virus circulating, and there were some very nasty infections that led to long-term problems, neurological problems, fertility or respiratory problems, and so on, that people forget about or don't sort of register. But it could be even worse now, because the people that aren't vaccinated and haven't been exposed to the virus spreading naturally in the community might be at greater risk of these more severe episodes of infection and long-term problems. So that's why it is a concern. It's not a mild disease. It's a vaccine-preventable disease, and we should be using vaccines to protect our population from it.
Finally, Professor Bennett, going back to those changes in the US where they no longer recommend broad protection against the likes of Hep A and B, meningitis, given the global world we live in, could that increase the risk of these viruses here? And could it also just cause confusion?
Look, absolutely. They had over 2,000 reported cases last year. So they become a source population for importing cases into countries like Australia. So it is a concern. People have suggested that there should be travel warnings linked to people coming in from America so that people are aware that the likelihood of these diseases is now going up in places like the US. There's been a recent shift in America, as we know. There's been a lot of misinformation. There's been a lot of movement and push against vaccines. They have rationalised some of these latest changes by saying they're following what's happening in Denmark, but they don't have the same population profile. They don't have the same public health access in America that they do in Denmark. And so there really is a different risk profile. And moving to a more pulled back vaccine program is inevitably going to lead to more vaccine preventable disease in the community, including things like hepatitis B that have long-term, lifelong health impacts on both the individuals and also on the health system itself. So we're really bracing ourselves for a resurgence of diseases that we thought we had been bringing under control for the last 50 years.